RQF BTEC Level 3 in Health and Social Care 2016 specification. Unit 10, Sociology. Learning aim C, examining how social inequalities, demographic change and patterns and trends affect health and social care delivery. Throughout our units, we've been looking at discrimination and inequalities, and there's the same inequalities within society. There's evidence that patterns of health and illness vary with social class. Those people being from the more affluent classes that can provide and afford private health care tend to do better with their health than those from the lower classes. Race and ethnic or national origin. We've seen with COVID-19 that those from a black ethnic minority background are more likely to be at risk from the disease. We have age, gender, sex, disability, sexual orientation and geographical region. These can all impact on our health and illness. Sociologists see social class in different ways. There is evidence that there's variation in health and well-being by social group or social class, particularly in the evidence of health or morbidity. Life expectancy. Members of the higher social class are living longer and enjoying better health than those of lower social groups. Studies that consider the reasons for the difference in class is the Black report and the Aitchison report. So if you get the chance, we did study this in Unit 8. Have a little recap of both of these reports. So sociological explanations that might account for differences in levels of illness and life expectancy. So the statistical artifact explanation is that researchers working on the Black report suggested that the statistic could have produced a biased picture. They argued that the lowest social classes has higher proportion of older people and people working in traditional and more dangerous industries. So it would be expected that they have a higher level of illness compared to those of more prosperous younger people working in offices. This explanation suggests that it's not really social class, but the age structure and patterns of employment of people in the lowest social classes. So, for example, suggesting that those in lower social classes are doing more manual jobs. However, the more recent studies have shown that even when the researchers account for this bias in employment and age, they still find a link between low social class, high levels of illness, and lower life expectancy. To continue, there is natural or social selection. This suggests that it's not low social class and the associated low wages, poverty and poorer housings that cause illness and higher infant mortality rates and lower life expectancy for adults. They believe it's the other way round. People are in the lower classes because of their poor health, absenteeism and lack of energy for success and promotion. So that's a different way to look at it. This theory is rejected, however, by sociologists, as there's evidence suggests that ill health is caused by deprived circumstances rather than by causing them. We now move on to cultural or behavioural expectations. This focuses on the behaviour and lifestyle choices of people in the lower social classes. There was evidence that people in the lower social classes smoked more, they drank more heavily, and they're more likely to eat junk food and takes insufficient exercise, which means not enough exercise. Poor lifestyle choices were linked to a range of chronic illnesses, including heart disease and cancer. However, the fact is, people in economically deprived areas use smoking and drinking to help them cope with their circumstances. So this could be a reason behind them having to deal with the situation that they're in. They're turning to smoking, they're turning to drinking to help them feel better about it. Difficult circumstances that lead to their lifestyle choices and not the other way round. So it's looking at the way in which their life, their jobs have led them to their lifestyle choice, led them to smoke and not the other way round. Material or structural explanations. Material explanations claim that those social groups for whom life expectancy is shorter and for whom infant mortality rates are higher suffer poorer health than those other groups because of inequalities in wealth and income. Basically, poverty and persistently low incomes are associated with poorer diets because you're unable to afford the better quality food, the fruits, because the snacks tend to be cheaper in price. And also the poorer housing. If you're on a low income, you're not going to be able to afford the top of the range house. Your house, you may be live in a house that perhaps has heat problems, or it may have mold, or it may be damp. And that again is associated with ill health. The writers of the Black Report presented very persuasive evidence to support the materialist explanation. Shaw et al. Believe that poor health and lower life expectancy is a consequence of poverty in a community. Race and ethnicity. Link between race and ethnicity in illness is difficult to study as there are difficulties in defining a person's racial type, especially those that have mixed heritage. High proportion of people from minority ethnic groups live in areas of deprivation. It's difficult to know whether their poorer health is due to poverty or ethnicity. Compared to the white majority ethnic group, there is evidence that there is a higher instance of rickets in children from the Asian community because of deficiency of vitamin D. Most ethnic minority groups have a shorter life expectancy, and most minority ethnic groups have a higher infant mortality rate, which is a death rate, a higher infant death rate. Language problems have been known to cause barriers. Translators are in very short supply. And some Asian women are very reluctant to be seen by a male doctor, which could, in consequence, affect their health. And also that they can be vulnerable to levels of high ill health. Age. Many people over retirement age are fit, healthy, making valuable contributions, perhaps doing voluntary activities and caring for members of their family, such as their grandchildren. In 2013, employment rates for over 65 was 10%. This is the highest since records have begun. 1.3 million over 65 have a care responsibility. That could be their partner or looking after their grandchildren, as I've discussed previously. There are higher levels of illness in the older population, especially those aged 75 or over. One person in 79 in the UK suffers now with dementia. Those over 65, it is 1 in 14, and those over 80 is 1 in 6. Very high numbers. Women's life expectancy is higher than that of a man. Women in our society live on average 5 years longer than men. There are higher levels of illness for women than men though. Women have a higher rate of diagnosed stress-related illness due to their willingness to discuss mental health issues with a doctor. They tend to have a higher rate of stress-related illness recorded than men, and that's believed because men may be less likely to speak to their doctor when they're stressed or worried about mental or health problems. So social factors that can have an impact on a woman's health could be lifestyle factors. High death rate with men can be linked to high levels of smoking and drinking with men. And women do tend to, on average, smoke and drink less. Economic inequalities. There's a direct link between poverty and ill health. Women still earn less than men. Higher percentage of women are low-paid part-time work, often so that they can care for their children as well. Main carers in lone parent families are more likely to be on benefits. The impact of the female role. Women are still seen as the main care providers, and also they still take up the majority and have responsibility for the majority of housework in most homes. Therefore, the higher rate of depression could be linked to the dull nature of this, or trying to juggle work, trying to juggle housework, trying to juggle being the main care provider for a child, and that in itself is very difficult. It's also Poppe and Bartley, 1989, found that women spent more time on housework than their male partners, even if they had a full-time job. So there's still considered lots of inequality on housework and like I say, the responsibility of who's there for the child, who's most likely to take a day off sick if their child is ill, etc. Disability. Disability arises when a society does not address the specific needs of people with impairments. The Disability Discrimination Act in 1995 and Equality Act 2010 have attempted to ensure that people with impairments will be able to participate fully in society. However, sociology has found a high correlation between poverty and disability. It is a lot harder for someone that is disabled to get a job. They are more likely to be unemployed. In 2012, 43% of working age people with a disability were in paid employment, compared with 76% of the rest of the population of a working age. So you can see there's a huge difference in between those that are disabled and those that aren't. Sexual orientation. There is evidence to show that people who are LGBTIQ that they have a higher level of mental illness than heterosexual adults, or so-called straight adults. 55% of LGBTIQ school pupils have experienced bullying on account of their sexual orientation. Those that are bullied are at higher risk of suicide, self-harm and depression. 2 in 5 of those bullies that have been bullied have contemplated suicide. Suicide rates within the LGBTQ community is high. Region. So whereabouts in the country do you live? Health and illness vary in regions. Levels of ill health and reported disability are lower in more affluent areas. This is areas of wealth. Life expectancy is higher in richer areas. So you're expected to live much longer if you live in a nice area, such as, I'll go into explain it in a minute, like Kensington and Chelsea. So life expectancy for boys born in England and Wales was at its highest, 83.3 years old in Kensington and Chelsea, compared to Blackpool, which was 74.7 years. For boys and girls, the highest life expectancy is in areas of greater affluence or greater wealth, greater money, and the lowest in areas of high unemployment. It's really important to consider all of these factors when writing your assignment.